this is David Lee and from Prevent Connect, and welcome to today's Power and Prevention Ending Child Sexual Abuse web conference. Today's topic is Technology Strategies for Ending Child Sexual Abuse. This series is sponsored by Prevent Connect and the Ms. Foundation for Women. Power and Prevention web conference series is a national project to Prevent Connect and the California Coalition Against Sexual Assault with support from the Ms. Foundation, and information provided in this web conference do not necessarily represent the official views of the Ms. Foundation and CalCASA. With that, I am really pleased to introduce our hosts, series co-hosts. We have Cordelia Anderson and Joan Tabachnik. So I'm going to hand the podium over to the two of you. Hi, Cordelia and Joan.
Hi. Hey, thanks, David. It's nice to have you back. And since there's so many people that are new on here, I want to just say a word about who I am and have Joan do that about herself. I'm, as David said, we've been privileged to be able to co-host this series. I'm based in Minneapolis, Minnesota. I have my own training and consultation business, and this September will be 40 years for me of doing work to promote sexual health and prevent sexual harm, especially around child sexual abuse, exploitation, and sexual violence. Joan.
Great. And I am I'm also a consultant for the past about 10 years, and I've been working in the field of child sexual abuse prevention for about 25 now. And currently I'm actually on a fellowship with the Department of Justice, the SMART office, looking at sexual violence prevention. And I've been co-hosting these with Cordelia for a number of years, and just find these particular conversations that we can have just really wonderful. I think Ms. Foundation asked us to, the term they use is curate these series, and it really has been a chance for us to find these highlights that are happening in the field and bring them to a larger audience. I'm looking forward to this conversation today. And I think I'm doing the learning objective next.
You are?
So if you could go, I guess.
Oh, I'm in control. I love this, Joan.
Okay, I think you're.
Yeah, we're past that. We're past it.
Okay.
I don't know who's doing it now.
Okay,
there we are. There we are.
Okay, so the learning objectives for today is basically to analyze the evolution of what effective messaging would look like to reach those who are accessing child sexual abuse images. And we'll have a wonderful conversation about what it means to develop effective messages. And the second objective is to identify new ways for technology that can be used to be part of the solution.
And for those of you that haven't really heard the terminology child sexual abuse images, around the world, that is how child pornography is referred to. In the United States, we still have the legal term child pornography, and a lot of people still use that term, but the child sexual abuse images recognizes that indeed it's documentation of sex crime scenes against children. And certainly there's an overlap with the role of pornography in general, because as many of you know, yesterday's porn is today's mainstream media, and today's pornography is the main sex educator of children and youth, which is why we're spending a lot of time. It's one of the areas I spend a lot of time in, looking at the impact on children, youth, and culture. And different studies say different things, but generally the number one or number two type of pornography searched for around the world is teen pornography. So there's overlaps, and we'll go back to Joan with why this session.
So partly we want to really talk about is, we call it like flipping the focus here. So we're going to flip the focus to think about child sexual abuse prevention, but looking at preventing the initial or first-time perpetration of sexual abuse. So we're looking at what we know about the people who abuse, and these are today's mostly about adults, but we also, when we look at flipping the focus, we talk about also what we know about adolescents or even children who may sexually abuse. And the way I like to sometimes explain this to people who are not in our work, not in the field, is that most people get the idea that you need to teach children that no one has the right to touch you. And what this flipping the focus means that not only do you have no one has the right to touch you, but that you don't have the right to touch somebody else. So that's kind of what we mean by flipping the focus here. And I think the other piece that we want to be talking about is that really acknowledge that, that although I think everybody who works in this field has the same values in terms of protecting children and protecting and ensuring that there are no more victims, and also finding ways of holding offenders accountable, that the professionals who certainly work in these different fields often have a slightly different perspective. So the professionals who work with victims might have a slightly different perspective from those who work with offenders. People who work in public health might have a different perspective than people in criminal justice, and people in criminal justice may have a different perspective than those in restorative justice. So we want to acknowledge that there are very different perspectives, and that also underlying this is a term which David Finkelhor has coined called juvenoia, which I love, which is just basically that every generation comes to thinking that what's happening in the next generation is just particularly scary. So I actually had a chance to go to the Rock and Roll Hall of Fame recently, and that when people were talking about how insidious rock and roll was going to be, how it was going to affect our children, and that the same thing is true of comic books. And so I think that there's a way the internet that we talk about it in this level of like now our children are really going to be destroyed because of this technology. And David Finkelhor just says basically that every change brings both new challenges but also some new benefits. And partly we're going to be looking at how do we make sure that we can protect children while they're also not discouraging the new benefits that are coming through the internet as well.
Hey, that's a really good next setup for this next one there that I just jumped ahead. I'm very touchy here, I guess. The role of technology. You're going to be hearing a lot more about that from our speaker. But we've also been kind of split as a field. I don't know with the new 50% of you on, if we've got more of you that really focus in the technology area of this. And it's unfortunate there's such a split between the people that focus more on child sexual abuse and exploitation and then more on technology-facilitated sexual abuse and exploitation. And the reality is there's lots of great uses. The whole idea of power and prevention and the whole idea of Prevent Connect and all the great work that's been done there is looking at using technology as part of our prevention. And technology for social change and movement building is something we're seeing so much more with. And we know that in many ways a lot of the content on technology and a lot of the uses of technology really took a lot of people back. And it happened so fast, and a lot of that was particularly as law enforcement would find ways to be successful at going after people who were misusing this and whole other ways of using technology that some people hadn't even thought about on the internet. Law enforcement there was a group, the Financial Coalition, law enforcement, banks, National Center for Missing and Exploited Children that came together to say, we got to make it so people cannot use their credit cards to pay for illegal activity like child sexual abuse images, child pornography. People were paying with credit cards. So law enforcement got ahead of that, and I'm sure a lot of you now are hearing about the dark web, new ways and new challenges as people can go further and then we try to use it for harmful means, and we try to find ways to use it also in more positive ways, which is why we're so excited about today's session. If you don't know about the Cyber Tip Line at the National Center for Missing and Exploited Children, where I've been a long-term board member, it is the place where online child sexual exploitation gets reported. It gets reported by the internet service providers. It gets reported by citizens. And since 1998, when since it's been going, there's been a constant and steady stream of increase in reporting. And you can see that demonstrated here, and particularly in that it is the child sexual abuse images compared to all other types that are so high, and they've now reached over 6 million reports. One subset of that is actively traded series of children, and these are people who like to collect and look at the series. And when we look at that subset of actively traded images, you see that gender split. It is dominantly girls, but 39% boys. So we've got to keep that in mind when it comes to the actively traded series. And look at the ages. 8% infant toddlers, and 62% prepubescent, 30% pubescent. So younger ages has been another one of those trends. And back to Joan.
Great. So first I want to say to people, I love that you're already using the chat for feedback, so I will try to speak a little louder, and hopefully this is helpful for those who said they had a hard time hearing me. I also, maybe while I'm speaking also, and while we're doing these last slides, we'd also be very curious to know, just if you could type in what discipline that you work in. So if you work in a child advocacy center, if you work in criminal justice or public health.
Here, actually, Joan, let's do something better than that. Let's do, let's ask people I have a list.
Oh, okay. I thought maybe you skipped that, so I was.
I missed it, so we got it now. So we will do this. So go ahead. On your screen, you appear what best describes you, and there's a whole long list of organizations. So let's go ahead, and it should be appearing on your screen, and go ahead and vote what is where you are, and I'm waiting for people to start doing it.
I'm sorry,
I have to ask the question. I'm sorry, I have to ask the question there. I didn't ask the question. Now I'm asking the question. Now what appears on your screen? What is it? Are you with the Sexual Violence Agency or Coalition, or Domestic Violence, or a dual, or a college or a university? Or are you with a state, territory, or federal public health or other? Are you with education K through 12, with child abuse or child maltreatment organizations, mental health, health care, criminal justice? I've got people voting. Let's see. So Joan, I will share the results. And what we can see is overwhelmingly we have people with sexual violence agencies or coalitions, 23% of our audience. The other 23% are duals, sexual violence, domestic violence. We also have a large group from child abuse and maltreatment. We also have a large group from criminal justice. We have a lot of people from mental health. We also have some people from colleges, universities, public health departments, and community-based organizations.
Great, thank you, David. So back to sort of what we, in terms of our introduction here, I just want to also just mention that social marketing is an area that is actually very applicable here. People have not heard about social marketing before. It's the use of commercial marketing principles and techniques to improve the welfare of people. It's a carefully planned and it's actually a long-term approach to changing human behavior. The slogan I often hear people talk about is, why can't we sell brotherhood the same way we sell soap? And it helps you decide which people you want to work with, what behavior do you want to influence, how to go about it, and how to measure it. And this has been used by many different organizations you're familiar with, like MAD, Mothers Against Drunk Driving, and No Smoking campaigns. And I think what I love most about the idea of using some private sector principles for reaching out and changing human behavior and changing basically the welfare of our people is to think about in terms of how do you create specific targets. I think one of the things we often do in our field is we want to reach everybody. And what this is like, what is the actual group we want to reach, and what kind of message do we want to reach them with? And the last piece I want to say that what is exciting to me about this particular project today is that it really is a fabulous example. Thorn, I think, is a fabulous example of a nonprofit working with technology industry and reaching out not only to industry but also to experts in the field. So Thorn has, and Leah will be talking about it, has talked to Michael Cito, who is an expert in this field, has talked to organizations like Stop It Now, as well as the Association for the Treatment of Sexual Abusers. They'd love to hear your feedback as we go along, and to say that we have a lot to learn from their work and how they've finessed messages to reach out to those who are accessing child pornography or child sexual abuse images. And I want to say that what I love about the approach is that they're paying attention to the voices of lived experiences to figure out where the best message is. So without further ado, I want to turn this back to Cordelia to do an introduction.
Okay, and I hope you can hear me better. I'll just try being louder and doing a little bit of shouting in the phone, and hopefully that will help. We are delighted to have Leah Treatman here from the Thorn, and she'll be talking a lot more about what she did. But what's exciting, one of the many exciting things about Leah is that before she was started working with Thorn, she was living abroad in Israel and working with African refugees. And she's been at Thorn as program manager for the last 2 years. And Thorn is they're another way that they identify as the Digital Defenders for Children. And she works on a lot of Thorn's programs that are focused on using technology to prevent and combat child sexual exploitation. So it's a perfect fit for us. Thorn does this work by conducting research, and they created a deterrence program you'll be hearing much more about in developing technology tools. Thorn's Innovation Lab and Technology Task Force research and brainstorm and build new technology solutions for this problem. We had the opportunity to hear Leah present to the Association of Treatment of Sexual Abusers ATSA's Prevention Committee that Joan and I are on, and Joan has been a leading force in. So she did a wonderful job, and we're delighted to be able to have her with us today. So now, Leah, we'll put you in the podium.
Great. And can everybody hear me?
Yes, we can.
I can hear you. Yep.
Okay, great. I think I'm not having the ability to flip through any slides right now.
Okay, I will do that.
Oh,
there you are.
perfect.
You should be able to be there
Yeah.
now. You're there.
Yep, this is great. Great. Well, thank you so much for the lovely introduction and also for all of the amazing information that you've shared with the group thus far. I'm very excited to be talking today about Thorn's deterrence program. And before I dive into our deterrence program, I want to take a step back and talk a little bit about Thorn and who we are and what we do. So we are a nonprofit that works specifically on driving technology innovation to fight child sexual exploitation. And there are multiple components of our work. So we do work on identifying and assisting victims and connecting them with help resources. And so we have some programs and tools there. We also do research on new and emerging trends like sextortion. So it's another area that we're moving into and that we're focusing on. And then we work on deterring predatory behavior online. And so that's going to be the focus of what I'm sharing today. And so the heart of what we do is really centered around our tech task force, and that's made up of around 30 companies that we collaborate with in our work and on our mission. And many of those companies helped us launch an innovation lab just last fall in Silicon Valley. And so we now have a team of data scientists and engineers working full-time on combating child sexual exploitation. So a bit about the deterrence program and why we sort of embarked on this program. And it's because people are using the internet to find child sexual abuse material and to connect with other people who really share this interest. And we've seen child pornography completely explode across the internet. And with the ease of access, many times there isn't somebody on there saying, you know, this isn't the right thing to be doing and maybe you should seek out other help options. So the problem has just sort of exploded with the use of the internet and that ease of access. You can see here in this graph that over the last few years, the number of reports to NCMEC has continued to grow. So talking with NCMEC and with law enforcement, what we were learning is that law enforcement isn't going to be able to arrest their way out of this, that it's such a massive problem and just continuing to grow. And if we can think through some innovative ways to use technology, we can hopefully be leaving the worst of the worst cases online for law enforcement to be investigating. And so what we do is communicate directly with the people that are searching for child pornography while they are searching for child pornography, and we're encouraging them to seek help. So what this looks like is that we are serving these online ads. So similar to if you are searching for a coffee shop in your area and you type into a search bar that you're looking for a coffee shop and an ad comes up saying, you know, here's the coffee shop that's close to you. We're sort of doing the same thing, but we're targeting keywords that are indicating that somebody is searching for child pornography. So when they're putting that keyword into their search query, it's going to trigger an ad, and that ad is going to bring people to our landing page where we're using different messaging tactics to really encourage them to seek help. And so we've been doing this work for over 5 years now, and our tactics have really changed across time. In the last year and a half, we really embarked on a lot of research to figure out what was the most effective messaging to get people to really change their behavior and to try and seek help. And we spoke with Dr. Cito, as was mentioned, and with Stop It Now UK, and with Stop It Now in the US, and also with the Association for the Treatment of Sexual Abusers, to really understand how we could make a significant change in this place. So some of our previous messaging tactics before embarking on that research and exploration are shown here. We were using scare tactics. So we would geolocate somebody on a map when they came to our page and say, if we can find you, so can the police. and that was really effective at getting people to just jump off the page. They were so nervous about what was going to happen to them that they weren't taking the time to realize these help options. And so we shifted from that to a little bit more of a humanizing approach, where we started to mention more about the help and talk to the people that were searching for this material, really as humans, and trying to understand what that means. And so we shifted our approach, and we also focused on maybe trying to trick people a little bit into clicking through to get help. So you can see that jailbait message in the corner. But over the last year and a half, we shifted our approach to really focusing on this as a public health issue and trying to market help. We're not accusatory in our messaging, which is really, really crucial. And we've been able to expand our audience because we are not accusatory. So because we're not saying, you did this, you're in trouble, we're opening up the doors to broaden the audience that we're speaking to, whereas before we were only focused on the worst of the worst sort of keywords and content and what that would mean. We're able to now communicate with people who are maybe searching for a little bit less egregious content, but they're at the beginning stages potentially of sort of going down that wormhole. So we've adopted some new messaging themes, and we're in the process of testing these to figure out the best ways to convince people searching for child sexual abuse material to get help. And so our tactics are inform, empathetic, harm, hope, and consequences. And I'll go through now and show you guys a bit about what those look like. So our inform tactic is really the most basic tactic, just letting people know that this is illegal and that there is available help, and it's confidential and it's free, because that was many of the concerns and what we were hearing for why people had started to view the content, and the excuses that were being given that, well, it was online and I could find it, and if I could find it so easily, then why was it available? And so we, at a very basic level, want to let people know that this is illegal and that it is okay to get help for it. So you can see there's this big red button to get help, and we are directing people to Stop It Now US, and I'll talk a little bit more about them in a bit. And you can also see that there's a hotline number, so we are encouraging people to make a call and get help, and that also goes to Stop It Now in the US. And again, I'll talk a little bit about that later. So overall, this message, we wanted to let people know that just looking is not okay, that it's unacceptable, but that there are options to get help. Our next tactic is more of an empathetic message. So when we designed this message, it was directed more towards maybe a 16-year-old who is just realizing that they're sexually attracted to children. They haven't told anybody. They might feel really alone and isolated, and they don't know where to go or what to do because they're really scared. So we wanted to let them know that there are understanding people that are ready to help them, and that they can seek out this sort of treatment so that they don't continue down this path, and so that they don't harm a child. Because at the end of the day, all of this messaging is designed to change this behavior that potentially could be resulting in a hands-on offense, and already that is harming children that have been depicted in the imagery. Which leads great into the next tactic, which is the harm that this does to children. For some individuals, this might be the messaging that resonates, pointing out that there is a child on the other side of this, and that we really want to be creating safe environments for our kids, and this is not a victimless crime. So really humanizing this on the child end of things may be a great tactic to encourage individuals to seek help. Our next tactic is the harm that it causes to themselves. And so we know that many individuals who are consuming child pornography feel disgusted and they feel ashamed and they hate themselves and they hate their lives. And so we want to reach out to those people and tap into that so that they realize that there is an alternative route, that they don't need to live with this regret and with this shame, and encourage them to make the choice without regret so that they can stop this cycle and try and really help themselves. In a similar vein, we have a tactic that focuses on hope, and so that there is hope to build a better life, and there is confidential and anonymous treatment that can help them build more satisfying and appropriate healthy relationships, that they don't need to be using child pornography or child sexual abuse material, and they can try and change their behavior and really get some help. And the last tactic focuses purely on the consequences. So the idea of building a better life and making a choice without regret is not going to resonate with everybody. And in fact, it might not resonate with many. And so we want to point out the consequences, that you can lose your family, you can lose your job, you can go to prison, you can have to register as a sex offender, and that, this really just isn't worth it. And throughout all of the tactics, we're pointing out that, this isn't okay and that this is illegal, but additionally sort of marketing that helps so that we can stop this behavior. This last page is our homepage. It's got sort of the most really basic messaging that child pornography is illegal. And so far in some of our preliminary tests, this page is working quite well at getting people to take those next steps and start to explore different help options. So this is an example of the search ad. So this is what somebody would see if you look at the bottom where it says pure nudism pictures, and it says ad www.underagechildguard.org. So that last ad is what would show up when somebody were to search for a keyword like pure nudism pictures. And because we've been able to be non-accusatory in our messaging and expand that audience, this area of pure nudism pictures is a new area that we're able to explore. Previously, I mentioned that we were looking at just the most egregious keywords that somebody might be searching, but there are new ways that people are starting to look for this material, and there's new sort of keywords that are coming up. And so because we were not telling anybody that they necessarily did something wrong, we're able to expand to areas that are maybe a little bit in that gray zone between legal and illegal content, and still try and market that help to them. And additionally, another important part of that message not being accusatory is that it sort of contradicts the idea of trying to get somebody help when you're telling them you did this thing wrong. So another sort of reason why our messages are not accusatory. A key component is that we are remarketing people once they leave our page. So we're continually reminding people that we are out there, that there is help available, and it's also really decreasing that anonymity, because once somebody comes to a page and then they leave it, if they see this message popping up and you can see all of this imagery really links with the pages that they would have seen, it's that reminder that somebody is out there. They know that I looked at this, and maybe I really do need to consider other options. It also will be reaching them hopefully at a point when they're not sexually aroused anymore. And I guess taking even a step back with remarketing, what that looks like is having somebody searching for the news or checking the weather, and then they're going to see this ad. So they're no longer looking for the content, but they're getting these constant reminders that help is available and that there are alternatives to searching for this material. We also have decoy videos in peer-to-peer networks. So peer-to-peer is another space where people are directly exchanging content from one computer to another. And we have files seeded in these networks that show some of this messaging and also encourage people to make the call, visit the website, and get help. Our decoy files have been downloaded over 2 million times since June of 2012. And we've also had over 1.6 million visitors to our landing pages. So those different pages that I was showing and those different tactics have been seen over 1.6 million times, and more than 40,000 instances, individuals took those further action steps to seek help. So they went to the website, they clicked on that big red Get Help button, they made a phone call to the hotline, they sent an email, they took another step to try and explore what other options were out there and try and really get themselves some help. So we partner with Stop It Now, and this is where we are sending people. So they are a national sex abuse prevention program that includes a confidential helpline for adults and potentially youth who have abused children or who are at risk of abusing children. So in addition to the calls, they have a website full of resources. They receive emails. They've recently launched a new chat feature for individuals to be chatting to try and seek help. And so this Stop It Now is an incredible partner, an incredible resource in getting folks the help that they need. Yeah, and I think that wraps up a lot of what I wanted to talk about. So if we want to, I can hand it back over to Cordelia or to David.
Okay. Great. Thank you, Leah. Boy, that was a very efficient coverage. I think there's a lot of material in that we can go back and have some discussion about, and there's been a number of good questions. I know we've been tracking, and we're ready to ask you a bunch of questions that reflect what what participants have been saying. But what we'd like to hear before we start that, one of the things we want to know from participants, but we'd like to ask Leah to just start us with, is what benefits you see to this type of program. So everybody that's listening, as you listen to Leah, what are some of the benefits that you can see from this kind of programming? And I don't know, to the field and to all of us that are doing advocacy and prevention, what are the benefits of having a partner like the Thorn and doing the Thorn Deterrence Project?
Yeah, and on our end, we see a really unique opportunity to be using technology to keep families and to keep communities safer. Starting at the beginning of why we embarked on this type of programming, there are so many people consuming child pornography, and law enforcement cannot go and find each and every person. So if we offer these different help alternatives and we use technology in innovative ways to reach these people, we can be heading off that behavior before it continues to places that we hope that it doesn't.
And people have had a lot of ideas on there, like just the way that this helps change the norm from this being so acceptable because it's so dominant, as you said, to actually having that sense be challenged and to recognizing the harm. And other people talked about just how exciting it is to have technology companies actually getting in and helping and being on the preventive end of this and preventing initial offenses and possibly even decreasing recidivism, although you're really trying to focus on stopping people from ever doing harm beyond what they are by looking at the images. And they also talked about some of the other ideas people had was just how it eliminates that complete sense of safety and anonymity for people, as you've mentioned many times. So those were some of the things that they said, and just the power of knowing that help is out there, and so on.
Yeah, and I particularly like just that Jenny Coleman, who is the executive director of Stop It Now, just wrote in and basically said from Stop It Now that more folks are reaching out to help. More people are contacting them. What I think is so exciting that so that before that they have harmed anybody, and that is just it's an avenue. I don't think what I love about Leah, that what you do is that he's not saying this is the answer, but maybe a piece of the puzzle here that really could be added, and I think that's very, very exciting. We just, as you were speaking, just tons of questions came in, Leah, and that was, I just want to echo what Cordelia just said. That was a great presentation. So maybe just let people know that if they have questions, to please type them in. We'll try to get to as many of them as possible. And some of the questions you actually answered all the way through. But one of the things that I think came up a couple of times, and we're just wondering, that because I think part of what you're trying to do is change some of the social norms and reduce, give people a sense of hope. But are you doing anything in terms of, or how do you maybe combine what you're doing with maybe some efforts that might be to combat the problem of interest in the first place, so that more broader questions? And I'm wondering, Leah, if that's something that you at Thorn have talked about or thought about, as well as sort of responding to people who are maybe reaching out for help. But how do you actually change that? Maybe the larger interest or social norm around this?
I think that it's an area that we are interested in exploring further as well. We are embarking on some research to better understand what some of those root causes are and how they can be addressed. So I don't know that we have, a program or tool in place currently that's that one layer below looking at some of the root causes and why folks are interested in this material in the first place. But to your point, just starting that conversation around prevention and how it can be, used on the potential offender side as well, getting folks to feel more comfortable with the idea of getting help, so that we have more people reaching out and that becomes less stigmatized and less scary. It can do a lot to stop the hands-on abuse. We hope down the road that this will be doing a lot to curb that behavior.
And one of the comments really relates to that even though there's a whole lot broader issues about just demand and how children are depicted in the media and dealt with as sexual commodities increasingly kind of in our hypersexualized media, one of the participants just commented on when people are just looking and they've kind of crisscrossed over that blurry line of what this is, that just for some people that don't even have the knowledge that this is illegal and that this is harmful, that education and that counter message is so key that you're doing. And we've had several comments to that point. We've also had a number that relate to just that, I don't know if it's confusion or if it's just that blurry line between when you're trying to reach people who have not, before they've ever harmed a child in any other way than looking at this. And that's really a key target audience there, because several people ask questions related to that, like how do you get around mandatory reporting? And part of that is you're trying to get people who haven't offended, but I don't know if you want to add anything to that. And really related to that is how do people on this know that when they click, they're not going to be reported?
Yeah, that is a great question, and it's also something that we struggle with. I mean, we write on there that it's confidential and that it's anonymous, but that fear of that, am I going to be reported by clicking on this? It is a barrier that is hard to overcome. And in terms of, hopefully reaching people before they've done something, or how we work with mandatory reporting. For the purposes of this program, somebody has searched for material, right? They've searched for a keyword that's indicating that they're looking for child sexual abuse material. But if they have not actually consumed material, and they've clicked on our ad, so they didn't get to material, of course, by that route, they have not done something that we can confirm. They have only clicked on our ad to get help. So there's not any mandatory reporting issues that come into play really in this program.
And one of the other questions that came.
Maybe just to add to that, I think, again, Jenny's responding, and I guess maybe I should have said in my introduction that I actually, for the first 10 years or 12 years of my career, I actually worked with Stop It Now, so I'm familiar with the helpline and all of that. And I think the other piece that I think from Thorn, certainly that is people click on the Get Help piece, and they, if they get referred to Stop It Now, that Stop It Now has been offering sort of offering an anonymous, helpline for many years, but that there is limits to that anonymity, and so that if people do identify themselves and identify that they have done something, they would be reported. So I think that although not every, it's making sure that since every mandated reporting law is a little bit different from state to state, that I know that Stop It Now does act within not just the letter of the law, but also the spirit of the law of mandated reporting. So if someone is hopefully contacting them before they've downloaded anything, before they've committed a crime, they can be referred to help. But if they have committed a crime, that they understand the limits of the confidentiality. So they do stay. They do follow. Stop It Now does follow mandated reporting laws and has for many years now.
Absolutely.
Cordelia, did I cut you off, or did you want me to jump into another
That's
question?
okay. That's okay. We can't see each other, so that's what we have to do, And that was a really good follow-up. That was really key. And I know Sandy Wirtle's on the line, and she said that it seems that the ads are targeting men, which is, of course, the dominant users. But what about the female viewers? Have you had any thoughts about that?
Yeah, there are female viewers. But it is predominantly men. Upwards of 80% of the folks that come to our page are men. So our messaging, I think it's maybe more with the imagery that's directed at men. I think the messaging could resonate with both males and females. But if there are suggestions on ways to improve that, or new options or avenues that folks have that we can be exploring, or ways to be doing more gender-based work, I would absolutely love to hear those and to connect and have a discussion around that. Our targeting is based just on the search query. So before somebody receives our message, we aren't aware if they're a male or a female. It's more in the aggregate data that we're able to collect, that we're capturing some of that information, and we know that it's upwards of 80% are males, and that's based on other information that's being collected based on other websites that they're viewing, but there's also the potential that there's one computer that's being used in a household, so it might not always be registering that correctly as well.
And another thing we follow up onto that too is that a number of people have asked now that you really described a number of different really interesting approaches, from a hopeful message to one of consequences, one's empathetic. How do you decide which ads to use for which people, or how do you think about which results are showing you different people might be responding more to one versus another? Do you have any way of distinguishing those?
That is a fabulous question. So that is the research that we are currently doing. So we have this really large list of keywords that we are targeting, but we don't necessarily know yet which we can't target a specific user. We have these ideas of maybe the kinds of people that are consuming our messaging, but we can't target them specifically, but we can target the keyword. So with this big list of keywords, what we're doing right now is figuring out which keywords resonate best with which messaging, and then we'll be able to further refine and optimize the campaign and try and target specific keywords or strings of keywords to specific kinds of messaging. So if people are searching for the most egregious content, what's the message that's going to convince them to get help? Or if people are starting maybe with some more basic keywords, what's the messaging that's going to get them help? Or if people are searching for a specific age, then what's the messaging that's most likely to get them help?
And somebody else related to that. Yeah, I think it's very, very exciting because, it's exciting on so many fronts, but I think about how expensive it is to do research and how long research takes, and then getting it published in a peer-reviewed, et cetera, and how we reach these messages. And you're using technology, and you're using these technological means to give us a whole different kind of insight and research than has traditionally been available. So that is exciting too. And you did mention when you were talking, Leah, a little bit about a message that might be better with youthful viewers. But there are a few questions about, do you have age-specific messages that might get at the more youthful viewers?
So again, we can only target the keyword, so we don't know if the person that's searching for using that keyword, like who put in the search query, we can only see what they searched. But the idea of getting this prevention messaging and these help resources to a younger audience is something that's on our roadmap and our strategy. We see a lot of value in reaching the youngest folks possible. So that's an area right now that we're exploring to try and figure out what the best strategy is there to reach the younger folks that are searching for this and really try and get them help.
Great. One of the questions that come up, and I just love, I love the conversation that's happening also sort of in the text, and I'm wondering, just one of the questions that came up was that couldn't the police also use some of the same techniques to track and to also arrest users? And I'm wondering if that's something that, like how you have interfaced with maybe some of the operations that may be online as well, or if you have done that kind of work, as you mentioned, talking with NCMEC, certainly that's part of what they do, but also local police. And I'm just wondering how you navigate that there's a number of people using some of the same techniques, and maybe also sort of as you're offering confidential help, could there also be somebody tracking them at the same time? So I wonder if you can just speak to just your interface with the police.
Yeah, so we work with law enforcement on multiple programs, and our deterrence work is not one where we're interfacing directly with law enforcement on because of that idea that they have not done anything illegal that we can see. So I'm not sure. Law enforcement, I could potentially deploy something similar, but I don't know how they would also be able to confirm that somebody is doing something illegal. So none of our information is connecting with law enforcement at all, and I'm not sure they would be able to work a program like that.
And I can add to another piece of that too. As you said, like with the National Center for Missing and Exploited Children, NCMEC, for people that don't know the acronyms, they have used technology and work with many technology companies as well on that other end of trying to track people that they know to be actively engaged in abuse, and trying to identify through the Child Victim Identification Program who those victims are. And many of the law enforcement over the years, when discussions were had about, okay, we've got the technology now. I think, Leah, sometimes you show a slide too, but I know I've seen it at NCMEC where you can literally, law enforcement has the ability to go on and show a map of the U.S., the map of the world, and show every computer that currently has child sexual abuse images on it where somebody's accessing it. So when you look at that, it's just painful, and you think, oh, there's just, like you said very clearly, and I've heard them say many times, we cannot arrest our way out of it. Arresting it would be impossible and likely by no means the best way to deal with all of that. So, but their job wasn't. They're focused on arresting people who've committed a crime. So their jobs weren't focused on what could we possibly do to get information or messaging out to people, although we've had that discussion, and they said that's for somebody else to do. So that's why it's so thrilling that this program came up over 5 years ago and has been attempting to do just that. So as Joan said, there are different players working on different pieces of this puzzle, and we need each other. We need to be learning from each other. We need to know each other's there. No one of us can do it all, and it's just that intersection and that understanding of what each other is doing is key. And that kind of relates to another question, Leah, that you could maybe help clarify for people. They noticed different phone numbers on the different ad messages and wondered if those were on your different messages with where people could connect in, and they were wondering if those were lines that they should be listing on the resource list.
Yeah, so the best number to list on a resource list is going to be Stop It Now's direct number. So the reason that we have different numbers on each of our pages is so that we can track how many calls are coming on to each one of those pages and better understand which messaging is most effective at getting somebody to, really pick up the phone and make that call. So that the different numbers are more from a measurement perspective for us, but the best number to use in any resources is going to be Stop It Now's direct number.
And Leah, I don't know, is anybody else, your voice is breaking up to me for the last couple answers. Is that only me that's having that problem, or are other people?
We're having that. If you can move a little further away, Leah, from the phone, I think that will help.
Go further away from it?
No, you're getting worse, Leah.
Uh-oh.
You're not getting worse. Your sound is getting worse.
Actually, David, I'm having trouble with your sound too, so I don't know. We're all breaking up. Or they said David and Leah. I don't know if I'm breaking up to everybody too.
I can hear you perfectly, Cordelia, if that helps.
Okay, and I can hear you. Okay, the sound.
So maybe while you're working on the sound, one of the things that I couldn't hear so easily was that the number to use as a resource number is the Stop It Now direct number, which is 1-888-PREVENT. So that's something which Jenny Coleman just wrote in, but I want to just mention that as well.
And there were other questions that certainly relate to a lot of the work that we do, just about the intersection between what you're doing and trying to, there were different questions about what about pornography and the pornography industry in general and the outreach of that, and how does that link. And again, that's a great question related to the work that some of us are and different organizations are doing. We've had past webinars just on the impact of pornography and the resources therein to try to do some messaging about that. So that's certainly from the National Coalition on Sexual Exploitation to Culture Reframed, Stop Porn Culture, to Your Brain on Porn, to my organization, Sensibilities in Me. I spend a lot of time on that issue. There are many people looking at this as a public health issue based on the new neuroscience, particularly, that shows the impact on brain functioning and how that then affects behavior, but actually shows an impact on, particularly with younger and more frequent use, on brain development, brain functioning, as well as physical functioning. So it's a whole different kind of emerging science just about the impact of pornography in general. And one of the reasons why it's so important for us to stay connected and keep sharing information and research and look at actions, policies, practices, as well as education and these kind of deterrence efforts to try to get people more accurate information. because that's another place where in searching in general, people certainly had the information that it's just sex, it's harmless, there's no impact, and sometimes have no clue about what the impact could be, including when it crosses over to what would be recognized as illegal images.
And are we having any sound, David and Leah? Can you speak a little bit so we can check to see if we can ask questions again? Or if not, Cordelia and I can talk a little bit longer about some of the things we know about.
I'm back on. Leah, I think you're going to have to hang up and join again.
David, you're breaking up. David, you're breaking up too. That's what everybody's saying, and that's what I hear. It's both David and Leah are breaking up.
I did call back in. I will.
This is the wonders. This is why we love technology. It's pros and cons, and when it works and when it doesn't.
So one of the things I was thinking of just maybe talking about, if hopefully everybody can hear me, and if you can't, please type in, let me know. But that in terms of some other interested partners in this, I think if people are interested in this field in particular, that there's a couple other programs that I think are doing some really interesting work. So, for example, Elizabeth Letourneau, who is at the Moore Center, which is part of Johns Hopkins University, has a program called Help Wanted. And she's partnered actually with Luke Malone, and who did a wonderful program on This American Life. If you have not listened to it, you should, which is really about saying that there's a number of young people who have identified as being sexually attracted to children, and that they want help, and they began to find each other. And what this partnership has done is they're beginning to do some research about what kind of help would be helpful to these young people who are struggling with that attraction. So that's a great program. There's another program called Blue Rock Institute that Charles Flinton out in San Francisco, and he's partnering with Kaiser, that when people do come to their health provider saying, I have this addiction with pornography, I'm afraid that it may be leading me directions that might be illegal, can I get some help? And he's finding that some people are self-reporting and self-disclosing and reaching out for help. So to me, those are some really exciting innovations that are happening in our field that weren't there even 5 years ago. And I think you're speaking to the fact that we understand that there are some people who are making a series of decisions, and that if we can reach them before they make decisions that actually bring them into something which is harmful to children, that's what they want as well as that's what we want to keep our community safer.
And on that note, too, while we're working on this, I'll mention two others. One is on a slightly different lens from this pie that relates to some of the questions is the FortifyPrograms.com, FortifyProgram.com, and that's related to Fight the New Drug. But the Fortify Treatment Program is an online treatment program for youth who have identified pornography being a significant problem in their life. And this is, again, pornography in general, but it's an online program they apply for, they go through. It can be in concert with other treatment, or it can be there alone. And since they launched in February 2014, they've had over 21,000 applicants for all around the world who've gone through this program, and they address the links between anxiety and depression and other indicators and lack of places for them to go and alternatives. So that's something to know about. And also related, people that have been doing great work, InternetBehaviors.com is, if you look at Internet Behaviors with Elizabeth Griffin and David Delmonico, they have, and again, this is a slightly different lens by far than what Thorne's talking about, but acceptable use policies to talk about in families, to look at, and again, in general, not when we're talking about the illegal activity, but they do have, she's talked also, I think, about all the attention to consent, another thing for us to, important attention to consent, another aspect of us to think about, which does overlap with some of the things Leah was discussing, is what's an informed consent? Like if the message has been that this is perfectly normative, there is no harm, nobody's being hurt, in fact, you're expected to use it, then and it's just sex, etc., then there's none of the informed information about potential harm or where it could cross the line to be being illegal or where it could hurt your health or where it is actually hurting somebody that you don't think is being hurt. So that whole notion of informed consent and acceptable use is another thing that they have at InternetBehaviors.com. And Leah, is your voice back on? Let's hear you.
I'm back here. Is this working?
We are still hearing a blibbled voice, but let's see if there's other questions, because we can also repeat and help work with this. And because this is being both recorded and our words are being typed in, that may also help people.
And maybe just as another question, Leah, just is that one thing people ask is that how if they could basically use you as Thorn as a resource, and maybe how do they publish that? And certainly you clarified the phone number issue, but is there a particular way that you would like to be listed as a resource so that people who are providing resources locally could also list you as a possible partner?
Yeah, if there are any folks that want to learn more about the program or see how they can be using this information to expand it or improve it or whatnot, I mean, I'm happy to connect directly. From a resource standpoint, I think Stop It Now has like the actual training materials and curriculum. They have the hotline, and they do incredible work in this space. And so I think they are the actual like tangible resources to push people towards. But in terms of like hosting a similar program, our website should be hopefully coming up on a few slides, and my contact information as well. And so I'm happy to connect with any folks directly that are interested in exploring the program further or ways to expand that. I'm also seeing a few questions coming up in the public chat, so I can speak to those if that works too, or I don't know if that's not the way that you guys usually do.
No, you can absolutely do that. I think that your voice is still very much the recording. What we hear is something very blibbled, so it's a little hard to understand. So maybe just even shorter lines with a little bit of pause, maybe people can help, or we can reinforce what you're saying with some of these questions. But as you've probably now had a chance to see, there's questions just related to human trafficking and child pornography, child sexual abuse images. What are the links, and how are you addressing some of those links?
Yes. So that is another area that we are currently exploring, and we're looking at facial recognition to see what some of those links are, and if we can make the connections between images that are child pornography and also used in child trafficking. So it's an area that we're just starting to see how technology can help us link victims of child pornography and also victims of child sex trafficking, victims and survivors.
And someone else asked, where actually is Thorn located?
Yeah, so we are based in Los Angeles, but we have folks that are in San Francisco. We have folks in Arizona, and I'm actually based out of New York. So we're a little bit of a dispersed workforce.
And then you have the lab in the new technology lab in Silicon Valley, right?
Yes, exactly.
So just to let people know that I think if you can turn on your closed captioning, then that actually makes it easier. If you can't fully understand Leah, you can actually read along as well. So it's a new kind of read along instead of sing along process, Leah.
We just need the little dot.
Right. And I'm just partly I'm just curious as what do you see as sort of the next challenge for you at Thorn? And I think that you're seeing hopefully also in this chat of just like people saying that this is a really interesting approach. People I think are really interested in the data that you're collecting now about which approaches are working, and also just impressed with the process you are using to collect the data in terms of using the different phone numbers, things like that. So I'm wondering what you see as the next sort of challenge or things that you're facing, and that might also be interesting for people to have a chance to give some input maybe to you as well.
Yeah. Somebody had mentioned this, how do we reach youth? And I think that is our next challenge and our next area of focus, because that, gets even at that younger level of prevention, versus having had more time to explore these different avenues. If we can reach the youngest audience possible that's exploring their sexual attractions and starting to realize things and make there is help available, so that they're not feeling as isolated. It's really, scary to reach out, especially as a child. You don't know where to go. You don't know what those resources are. So that is, where we see a lot of opportunity, and also, potentially some challenges in connecting with people. So that's where I see this program going in sort of the next avenue.
And one of the things, go ahead.
No, I was just going to follow up with I was just going to follow up with I think that what, to me, that's very exciting about that, Leah, is that, I think that all the research is certainly showing that the age at first perpetration is much younger than adults. As 14 is the average age. And that, it's certainly when you start looking at who's also downloading pornography, that, the access that kids have to pornography is so different now as well. So being able to reach, kids who are beginning to see that kind of, attraction that's not shifting as they get older, that's just that, I think all the research is really echoing that is an absolute ideal opportunity for prevention as well. So I'd really say that really echo that your future direction is really in line with where the research is. So Cordelia, back to you.
Okay. So one of the questions related to just, you've got all this great internal data, and you use this data to help inform the development of your program, which is just great. But you can see there's a bit of a thirst in our field that information could help really advance our knowledge. Do you ever post papers, or how do people, it informs your work, but it could also broader, in many ways, inform our field, and it's something of interest to a lot of the people that do this work. So how might people be able to get access to some of these things that you're learning?
That is sounds like a wonderful opportunity for us to explore. To date, it's just been in meeting people and sort of having those conversations. We have done a few presentations on the approach, but we haven't had opportunities or connections where we published any research on this or shared the data in that way. So I think it's something to explore further down the road. Also, we're constantly learning and testing new things. So it's our metrics are shifting, and we're learning and we're exploring, and we're challenging the program to hit the right or hit the best audience with the best messaging, and what that looks like. So I think for now, it's definitely great to connect one-on-one with anybody that's interested, and we're really happy to collaborate and share information. But we don't have any sort of channel set up where that's happening, publicly right now. But it would be a great avenue to explore.
And we want to just shift a little bit with one action that listeners want to take as a result. What's an action? You just named an action. You've named a couple actions, Leah, and you might have more going on your brain as a result of doing this, of other things that Thorn could do. But for our listeners and participants, what's an action that you will take in your work going forward now that you have heard this session? Can you think of an action? And that might also help us think of some. If people can type those in, what's something that you can do with this information? Advertise about Stop It Now and resources on their website. Spreading further awareness is coming in, which I know is something we can all do. Help talk about this, let people know this possibility, this whole other way of approaching this problem.
Well, I think that one of the things that really is exciting to me about, some of the stuff, Leah, that you're saying, that I always, even though as I said, I worked with Stop It Now for many years, that I think that the fact that you are looking at how do we sort of just, I think sort of silently and consistently start putting out messages in unexpected places. And So I know that what I find exciting is that I sort of get annoyed when I search for something on the internet, and then I find that that's popping up all the time. As I continue to look for other things or do other work, what I love about this is that this is a reminder that that people who are looking at pornography, at child pornography in particular, it's a series of decisions that they're making, and you're asking them to stop and think and make a choice. And that, to me, is one of the most exciting things, that you're putting that where people feel they have anonymity. You're putting that decision in the privacy of their home and reminding them that they do have a choice. And that, to me, is probably one of the most exciting things that I feel you're opening up with Thorn, and that we could use that in so many other ways as well, and so many other kinds of work that we do that has that same public health approach. So just really want to thank you for just tying this together so well on an issue that we don't talk about very much. So maybe that's partly my takeaway, as well as maybe some of the next action too.
You're not going to get off that easy, Joan. You have to think about a takeaway too. But and Leah, I mean, you might have something that you've said besides what you've heard from people that is something you're taking away from today. And this might help some of you think a little bit differently than an action item. I mean, one of the things that certainly is the reason David Lee and his whole group there, one of the reasons they want us to do these, and the funders want us to do these, is because hopefully the listeners aren't just listening and then walking away without some new idea, new piece of information, or something that they're taking away. So it would really help us to know what you're taking away from today. If that's a new resource, a new idea, a new piece of information, new questions, whatever it is. But if you could just type in things that you're taking away, and while I'll give you a little time to type that in while know that this is going to be recorded. So if there's other people you want to share this information with in a way other than just telling them about it themselves, it is recorded and you'll be able to get that. And David will be looping back and telling you more about that, I'm sure. But I have heard about Thorn since the beginning, because I heard about it through NCMEC and what was happening and what you were doing. And one of the takeaways for me that I just keep trying to do is do what I can to try to stay up on what you're doing, just to incorporate it into the training, just to add this whole dimension of possibility, along with some of the other resources that we talked about, to people that are doing this work. So again, not that we all have to do all of it, but isn't it nice to know that someone is? And what can we each be learning from each other? And how can we continue to learn from what you're learning is certainly one of my takeaways.
And
I think that...
Go ahead, Leah.
Go ahead.
So I was going to say one of my takeaways just here is that, Leah, is that I've been talking for many years about preventing, how important it is. You really want to think about primary prevention, about preventing sexual abuse before anyone is harmed, that you have to really look at what it means to prevent first-time perpetration. And often when I say that, people say, well, what do you mean? Can you explain that? And what I love about this is a very concrete way that you are offering people an opportunity to prevent first-time perpetration. And you offer that in a very concrete way. And I think that just, to me, is really exciting, that how do we, in our field, when we say this is, how do we be, we say a lot of things that I think to people outside our field, we don't make it concrete enough. When we talk about the importance of comprehensive, how do you make that concrete? Well, I think you have made this idea of preventing perpetration very, very concrete and very doable, and I really appreciate that a lot for the work that you're doing, Leah.
I think, too, this message of hope, here's a whole other part of hope, Leah, and that's somebody that's writing in, Amanda, thank you for this, that it's just good to know that some of the people that are looking at this and are seeking it are asking help before they perpetrate. And that, that's just exciting to know that people are seeking help.
Absolutely. And piggybacking on that, the program is showing that help is needed and it's wanted and it's desired, and there are folks that are willing to reach out and take it. So I think knowing about these resources is incredibly important. And then segueing, sort of a takeaway for me is thinking through how our sort of internal research and data that's happening to improve the program can be applied elsewhere, and how other folks can benefit from it, and what it might look like to be distributing that more widely. So I appreciate the feedback and the input from the audience as well, so I can start thinking that through and thinking what that can maybe look like.
That's great, and I think just that's a parallel track for NCMEC. One of the big things we looked at is that how to use their internal data that was what they used to improve how they did cases. And I would sit and listen to that, and I would go, oh my gosh, our field needs to know this. Our field needs to know this. Hence some of the slides and other information getting out beyond law enforcement to say, you need to know what's coming into the cyber tip line. You need to know the trends. You need to know what they understand. Even though that's just a subset of cases, it's what gets reported there. But it's really relevant information. And you clearly have struck a chord of excitement with people with information as you're learning, as you're changing, as you're being nimble, that can still really help our field. So we want to be sure to say thank you very much. And there's that slide a lot of people have been waiting for with contact information for Leah, who's an excellent resource.
And also all of the slides will be posted on the Prevent Connect website, and so there will be a follow-up email to everybody who's on the, everybody who's on it, and also everybody who's registered. They will get a follow-up email from David Lee and Prevent Connect, so you will be able to actually review both the slides and hopefully the recording as well.
And so we really want to, and David's been posting that a lot and just posted it again. So thank you, everybody. Great questions, great discussions. Leah, thank you so much for the time and attention you put into this. It's just a huge benefit. And someone is asking me to go back and make sure we get Leah's information up there a little bit longer because they want to make sure to get that. So, again, you'll be able to get all of the slides later and the contact information later. And thanks to Prevent Connect and Ms. Foundation for having made this series possible so far, and Prevent Connect to their commitment for that, and all of you for the work that you do.
Okay, thank you, everybody.
I don't know if I'm breaking up or am I breaking up now?
You are still breaking up, but we'll take it.
Okay, well, thanks, everyone, and this will conclude today's web conference. We'll keep the text chat open for another minute.
Thank you.
Thank you very much for having me, for allowing me to share this work.
Wonderful to have you, Leah. Take care, everybody. Bye-bye. This is Joan signing out.